It's an interesting situation, and as you try to put yourself in their shoes, you know, obviously a part of my life is public, but I do connect with that desire to be a little more private. I would think one of the main reasons to be private would be to avoid the hurtful comments, but as you just saw, whether you're private or public, they both receive comments that sometimes sting a little bit.
It's the big question, how public should you be with infertility? We're going to jump right into the debate with some help from a few experts. Joining us in the studio, Dr. Russell Falk from the Utah Fertility Center and therapist Julie Hanks from Wasatch Family Therapy.
First, Dr. Falk, it seems like we're hearing now more than ever couples who are struggling with infertility. Is the problem becoming more common, or are people just becoming more open about it?
Certainly more open. I think the fact that a lot of celebrities are broadcasting their infertility, it makes it appear like it's more common. But the incidence, the actual occurrence of infertility has been the same since we've been recording it. It's about 15% of all couples, or about 7 million people in the United States.
Julie, as we just saw, different people have different struggles and they deal with it differently. Yeah. But is this a struggle that everybody privately, internally has to go through?
Well, they do need to go through it privately and then decide who to share it with. And it kind of depends on so many factors: their personality, what their spouse wants. Do they want to broadcast it on a blog, or do they want to keep it personal? But I do think you don't want to just keep it to yourself. I mean, people need support going through painful times.
It would seem, you know, we could just say the phrase, it's different for everybody, but it would seem, does more pain come from keeping it private, do you think, generally speaking? I don't know if it's more or less, but I think you're struggling with it alone. And when we're in pain, that's a time when we want to reach out to other people. You know, when we see someone in pain, we want to comfort them. And that's a good thing about relationships, is that people want to comfort you. But like you said, when you come out with something that's difficult, it also is vulnerable, and you can be hurt by comments. That can of worms. Well, let's talk about those comments. What should you not say to someone who is struggling with infertility?
Well, I think the key for anyone trying to help someone is to be informed, be sensitive, and be supportive. And I think the key to sharing your struggles is to be informed. And I think people who say some of those negative comments often are doing it in an effort to be helpful, but they don't know what to say. And part of that is because they don't know much about infertility. So the reason why you should search out and share your struggles with those that you might care about is to learn about it, is to see if they have some insight into how to overcome the disease. Because if you can learn how to beat the disease, then you can get past it. It's like anything else in life. If you were diagnosed with cancer, you might share it with some people, and some people might say things that aren't quite so sensitive. But what's interesting and unique about infertility is that if you told someone that you had cancer, you don't get comments like, well, if you'd stop thinking about it, you'll get over it. Or if you go on a vacation, or if they say a little bit ridiculous things in an effort to help, but it's because they don't know what else to say. And so I think the key is, if you want to help somebody who has reached out for you for information, become informed. Go on the internet, find websites, find doctors, find information that you can then share with that person struggling with infertility and help them overcome the disease.
Julie, what do you think is a good thing to say or not to say to someone struggling with this?
Well, I think it's perfectly okay to say, I don't know what to say to support you. Can you help me? I love you. So sometimes we feel like we need to make something up if we feel awkward. I like to just name the awkward. I don't know what to say except I love you, how can I support you? And that's, I think, sometimes the best thing to say. And then that opens up a dialogue for you to be educated about it and see what your friend or loved one does want and what would feel supportive.
Dr. Falk, I realize you're a medical doctor, but you obviously deal with the emotions of the situation as well. Have you seen it pay off when a couple is more open and more vocal with family and friends about the struggle they're experiencing?
More times than not. I mean, there's direct times when we had a recent event where there was a 5K where couples could enroll and try to get people to support them financially so they can afford the treatments they need. And in this one case, Ben and Lacey, they had a family member, a grandparent, and other family members who learned about their struggles and then offered to pay for everything they needed. So that was an example where they didn't want to share it with their family until they were involved in this episode, and then all of a sudden the floodgates opened and all their prayers were answered. But on a smaller scale, I think if you reach out to someone you work with, or someone that may have struggled from infertility before, or had a family member struggle from it, they have a lot of insight insight into ways they can overcome it. And they've received the proper referral. They know what doctor to go to, what therapist to go to help them cope and overcome this disease.
How long would you say someone should wait, a couple struggling with infertility, before they tell other people? Is there some kind of time frame?
Well, the diagnosis of infertility is defined as after a year of trying with no success. And so it's at that time patients should start searching out, how do I beat this disease?
Julie, you agree with that, about a year out?
Yeah, I mean, that's when the diagnosis happens, and that's when it's like, okay, we need to change something here.
Yeah.
And that's seeking medical and then also emotional support from friends and family. And I think it's also really important to recognize that there's no shame in infertility. I think sometimes people keep it close because they feel like it says something bad about them as a person. And it's a disease. It's just something that happens in life. It doesn't mean there's something wrong with you as a human being.
And I like Dr. Falk's example of putting it side by side with cancer. That puts it in a whole different framework, a whole different perspective. Thank you so much, both of you, for sharing your insight and your expertise. We really appreciate it. You can reach Dr. Falk at the Utah Fertility Center and Julie Hanks at Wasatch Family Therapy.
And we'll be right back with more.